Welcome back and good morning, Central Oregon. All of this month, we are highlighting Poverty in America Awareness Month here in Central Oregon by focusing on the organizations that are on the front line of this battle here. And so today, we're talking about Volunteers in Medicine with Executive Director Kat Mastrangelo. And we are fortunate enough to get a patient's perspective from Mark O'Connell. So welcome.
Thank you.
Kat, first to you, Volunteers in Medicine Clinic of the Cascades. What do you do?
We are a free low-income clinic for people who live or work in Deschutes County. We do mostly primary care on site and provide medications to patients as well as referrals out into the community if somebody needs something like a surgery or something more complicated than we can do on site.
What kind of numbers are you looking at on a yearly basis?
Oh, yeah, you know, since we opened 7 years ago, we have taken care of over 8,000 people in Deschutes County. In any given year, it's about 1,500 to 2,000 patients that will come through our doors.
Well, and Mark, I really appreciate you being here. Thank you for being so willing to share your story. What brought you into the Volunteers in Medicine Clinic?
We got laid off from our jobs here up in Bend, and we're trying to figure out what to do. So we started our own businesses down in La Pine. And we heard about Volunteers in Medicine, so we've got to try and do something. A couple of years without medical insurance, you know, we had to try. So we did, and we qualified, and we've loved it ever since.
So you've had a great experience.
Yes.
And have you gone in just for routine things, or what? I don't want to impede on your privacy too much.
Routine things, and you know, my wife has a blood disorder, and they've helped with that, and you know, different things like colonoscopies and carpal tunnel surgery, which is coming up here this week. And I got diagnosed with diabetes through VIM, and so they've helped out with that too. So it's been great.
Did you ever personally feel like you would ever be taking advantage of these kinds of services? Because before, you know, when you're working, you were probably one of those who would donate to things like this, correct? Yeah. And so did you ever feel like you'd be on that end?
Never thought we would be on that end, but now that we are, I would recommend people go in there, even small business owners go in there and trying to qualify and take advantage of it while, you know, since it's here.
Yeah, you probably looked at the cost of providing your own health insurance, and it's just out of the ballpark for people.
Especially when you have a deductible that's over $5,000, and you know, a lot of things don't. A lot of things don't cover that. So.
That's right.
And that's what we find. I mean, the cost for a insurance premium for a family is $13,000 to $15,000 a year now. And so when we are taking care of patients, a family of 4, up to about $44,000 a year, if you do the math, $15,000 is just not in those numbers. And so really that's the population that we take care of. You know, people who are super low income or on Medicaid, they have access to care. It's the people that are in between, that are working, that have a part-time job or 2 or 3 part-time jobs, don't have benefits, but don't make enough to buy insurance. That's really the niche that we're trying to fill. Right here in Central Oregon.
And I know that when you opened right away, I remember being astonished by the numbers, because I don't think anybody anticipated. They knew it was going to be a lot of people, but it didn't anticipate it would be that many people.
Right, and we estimate there are probably 20 to 30,000 people who could qualify for our services right here in Central Oregon. Not everybody is in need of healthcare services at any given time, so that's why, you know, we have 1,500 to 1,000 patients at a time, but over 8,000 since we opened.
And we've got about a minute left, but part of the reason I think the Volunteers in Medicine is so successful is because you have a large volunteer corps.
Yes.
Correct?
We do. We have about 450 volunteers right now who are trained, ready to go. Any given week we'll have about 150 that come through our doors, including doctors, nurses, people who help schedule appointments, people who work in our pharmacy, interpreters. We have about 20% of our patients are Hispanic. And it's amazing how many people come through every single week through our clinic. It's really neat.
You talked about a lot of people who would qualify and may not realize it. Is there a specific phone number for them to call? It doesn't hurt to make a phone call and at least find out. out.
Exactly, and that would be the first step.
Okay.
And you would call 541-330-9001.
Okay.
And usually you have to leave a message, but somebody, either a volunteer or staff member, will call you back. And there's a few simple questions they'll ask you just over the phone. And if then it looks like you would be eligible for services, then we'll set up an appointment for you to come in for eligibility screening.
And now, is that also the same number where people who would like to volunteer?
Yes, they
call?
can start there or at our website, which is www.vim-cascades.org.
Okay, fantastic. So again, that's 541-330-9001 and vim-cascades.org. So it was really nice to see you both this
you.
morning. Thank you.
Thank
Mark,
you.
thank you for sharing your story.
Thank you. It's a pleasure.
I appreciate it. Thank you. And thank you for joining me today. I will see you right back here tomorrow.